So we give him penicillin for his pneumonia, and then he has an allergic reaction to that. So then we have to give epi, diphenhydramine, which is like Benadryl. Every single sim that's gone through has not been what was supposed to be, so I'm really nervous. Yeah, he ended up with a pneumothorax, so.
Help you breathe better, okay?
Good morning, everyone. Happy Saturday. Welcome to my channel, or welcome back to my channel and all that fun stuff. My name is Bailey. Today I have to go to in-person simulation lab. So that means that we go onto campus and we take care of a patient. We have a whole little scenario planned out for us for each of our groups that we have. So everyone has an individual patient, and we go in and we take care of that patient, and we deal with any complications that come up while we're caring for them. And it's just like we're in the hospital in like the nursing in the clinical setting, except we're taking care of a mannequin. But this mannequin can talk, it has vital signs. I don't know the full extent of everything that it can do. I've already done one sim lab, but it wasn't anything too crazy, but like their chest moves when they breathe, and it's a really, really expensive mannequin that does all the things. So we are going to that. It is currently 11:40 in the morning, so I have to be there by 1. I just got ready. I am about to eat something. My boyfriend is cooking for me, and I'm setting up my scrubs for today. We have to wear our scrubs. We have to be in full uniform. So yeah, I'll show you guys that. It's kind of a bittersweet moment because it's our last time going on campus this semester, so kind of sad. Last time I'll see my group when we're all together, because we got even more separated for next semester, sadly. I have my scrubs laid out. These are just the Cherokee brand, the workwear edition. But I really don't like these very much. They're not the softest, most comfortable material, and also the pants don't fit me very well. They kind of are too short, even though they're the long version. So I don't understand that, but yeah, I want to invest in new scrubs for next semester for sure. It just is a little bit more difficult because we have... Okay, thank you. My breakfast is ready. So yeah, we have to have this specific hunter green color, and then it can't have any other like colors on it. So some of them have like something right here that might be like a bright neon green or something. I don't know, just different stuff like that, and none of that. So it has to be all green. That's hard to find. We have to get it embroidered, and then like when I bought these, I was a little worried that even just this different material I would get in trouble for. That's how strict they are. So I love the top though. The top is super fitting, and if I can find a new pair of Cherokee pants that's a better material and they fit me better, then I might stick with the top. But we also have to have same brand top and bottom. So if I find a different brand, then I'm gonna have to switch both. And then I have to go and take them to get embroidered, which is a pain, but yeah. So I'm gonna get these on, I'm gonna eat my breakfast, and then I will update you guys later. Look at how sweet my boyfriend is. He made me a little egg sandwich and some coffee and my Christmas mug. I love it. Okay, so I have eaten, I am all changed and ready to go. Say hi, Maya. Say hi.
What?
I'm talking to Maya and the camera. Oh, there's Karma. Anyways, just thought I would show you my fit. See, this is what I'm talking about when I'm saying that these pants are too short on me. It's like if I put them up to where they're supposed to sit on my hips. Yeah, that's not the look. Not the look. So that's why I need new ones, because this high water crap is not it. But anyways, I'm about to head to campus, but Maya, can you shh for just a second, please? Okay, but I thought I would show you guys what I kind of went over before heading to sim. So come over here. Also, my Christmas sign that was out on our door fell off. We like opened the door this morning and it was on the ground. That was really sad. I don't know why it fell. But anyways, this is what I've been doing. I haven't really written that much craziness, but I have our patient, his diagnosis, and then the complication that we're gonna have to treat. So we give him penicillin for his pneumonia, and then he has an allergic reaction to that. So then we have to give epi, diphenhydramine, which is like Benadryl, albuterol to like open his airways, methylprednisone to decrease inflammation, that's a corticosteroid, and then ranitidine, which is an antihistamine. And yeah, I didn't realize that I was gonna have to be giving him so many meds, and they're all different like administrations. Some are IV, some are just like hanging a bag of fluids, and others are IV pushes. The epi is IM. I don't have a lot of information on the penicillin yet. I need to do a little bit more research into my case study for that. I just gave myself some things to remember when going into the assessment. If I have just like a list in my head that I can easily refer back to when I'm in seeing the patient, it's kind of helps combat my nerves and everything. So I know like as soon as I go in, I need to assess ECG and vital signs and do like a pain assessment. Then obviously respiratory assessment is top priority because he has pneumonia, suspected pneumonia. And then check his skin and stuff, ask about his cough, just like basic stuff when you're treating someone for pneumonia. And this is just like, I don't exactly know. We don't know the full scenario until we're actually in there. They give us a brief one, but the person that likes to run our simulations, he likes to keep us on our toes. So you could think you're going in to say treat an allergic reaction, and then we get in there and he's completely changed up the scenario on us. I hope that's not the case, but it could be. So even all of this prep work could be for nothing. And all of this stuff could already be done. He could just say like, okay, go right in, and first thing you need to do is administer the penicillin. Then all of that really would just kind of go out the window because that's already done. And then obviously I can't speak, obviously, monitor vital signs after administration of the medications. And then I'm heading to class early, so I'm going to try to do a little bit more research on the medications and stuff, kind of nursing interventions, adverse effects, contraindications, stuff like that that I should know for these medications. But yeah.
He's so funny as a little kid. You're just like, get in the car. I know. She's so right about this. Like, get in the car. Get in the car.
Shannon, say hi. I'm vlogging.
Constantly asking you to bring him something to eat, and then
then with the heifer, you will probably go to X.
Are you ready to go in?
I will put it in there.
Yes.
Who's he say next?
There we go.
Did he say?
Tell us a little bit about your patient.
Oh, he's taking the lid off.
It's a 67-year-old patient
Give him a
with
second change right
COPD.
now.
What?
He's doing the second change.
Oh. 67-year-old with COPD exacerbations. Nothing really crazy. You're just gonna give him. Do you have to put a chest tube in? No. Just do albuterol. Not fun. Nothing very eventful happening in mine. Yeah, we're just hanging out in this skills lab. Shannon's gonna try to get my
do the midterm, so I know they're gonna bitch about it.
it's just an oxygen machine. Shannon's gonna try to get my sim recorded, but it might be a legal issue.
Make sure you know that.
It's fine. We'll see. I really don't think it would be. But yeah, they just went through one simulation and now they're changing the gender of the mannequin from a female to a male, and then we'll go on to the next one. You guys did good. Yeah, you guys did really good actually.
That was good.
Yeah, that was long. I know you have trouble breathing, but I don't know what to do. I gotta get this together for you.
So I was telling them.
Okay, so I'm taking a little bathroom break, but Shannon's group is going right now. I got a little footage of her, and then my group is the last to go. Fun times. It's making my nerves a little crazy, but it's fine. He's been switching it at the guy that runs the simulation. Oh no, the bathrooms are closed. This is a fun little adventure. It's a Saturday, so everything is like closed on campus. But anyways, the guy that runs our simulations, he's been changing it up for everyone. Every single sim that's gone through has not been what it was supposed to be, so I'm really nervous for ours. Even if he does, oh yes, wait. That is the men's restroom. Where is the women's restroom? So even if ours stays the way that it's supposed to be, which is anaphylactic shock after administration of penicillin, then that's already gonna be like super difficult to treat. And then if he decides to like make him code or something, like, oh my gosh, a cat just ran by me and scared the crap out of me. How strange. There was a cat on campus. And finally, the women's restroom. I found it. Go Shannon, go! Okay, Shannon, how was it?
It was good at first.
Nerve-wracking?
Towards the end, yeah, it's just like you don't know what to do. So, like after I gave him his treatment, his like oxygen kept dropping down. It was all the way to 83, and I was like, what's going on? And then I forgot I should have reassessed him instead of that, but yeah, he ended up with a pneumothorax, so I caught that at the end. But
That's crazy.
you never know when you go in there. You never know.
Yeah, that's why I was just telling them now how he's like switching it all up, so we don't really know what to expect when they go in there. I'm so nervous for mine. I wish I wasn't last because it's just been building up and I'm getting so nervous.
I really think that you're gonna call code. I think you are.
That's what I have a feeling too. Me and Katie were talking about it while you were in there, and we're like, what is he gonna do to ours? Because it's already pretty intense with anaphylactic shock. But like, so he could just keep it, but like, does he want to keep us on our toes? So does he want to change it up?
We didn't have to call a code. Like, apparently, you don't have to call a code for pneumo, which I was like, oh, okay.
Yeah, maybe just like a rapid response, I would think, or something like that.
Well, whenever I say code, I mean like.
You mean rapid?
I don't mean just like code blue.
Yeah.
I mean like, yeah.
No, well, because well, you were in there when Carol was like, you don't call a code unless they're
Like, whenever I say code, I'm like in my head, I'm like, oh, rapid. Usually I'll say code blue if they're like done.
Yeah. But yeah, I hope not. I mean, I've done a code before, so I know how it goes.
This is different. This isn't CPR. This is like, we need to do something quick. This is ER stuff and stuff that we don't
I know.
do.
Well, wish me luck, guys. We're just taking a little break, and then last group to go in is me and Katie. So,
It'll be fine.
fun times.
What was it Kenneth Bronson's got wrong? My computer died.
Well, I did a whole thing on it. So he's a 27-year-old male. He has strep throat, and they're gonna give him antibiotics.
Oh, and then you went into anaphylactic.
Oh,
Yeah.
right. Oh, anaphylactic shock. Okay. Oh, what's Carl gonna do?
I know.
It's already bad as it is.
I
Like,
told this patient, I guarantee it.
yes.
Our next class on
Hi,
hold
my name
until
is
January.
Katie. This is Bailey.
So
We're
we
your
got down
nurses
to
today.
one
Can
and
you tell me?
Can you
Can you tell us your full name and date of birth, please?
Discussion questions. They've got to be 500 words. You've got to.
It looks like the
Carol, do you think that's where nursing's
has
going?
ordered a shot of
Do you think that's where nursing's going?
for
More
you.
like getting your
Shot of
master's, getting your
penicillin.
doctorate? In
Have you
nursing,
ever
or
had
do you think it's still
penicillin
kind of...
before?
To work as a nurse.
Are you allergic?
The bachelor's.
Any family history of allergies to penicillin or?
Okay.
Now to
Okay.
teach.
Well, that is good to know. We will we'll contact the physician, nurse practitioner, and
It's kicking my butt. It's a butt kicker.
for Kenneth Bronson.
So she called about the penicillin because he has a family history of, and then so they changed the order.
Okay.
I just do it.
I was like, I almost had a needle stick right there.
Oh, on their reflection.
Doing?
He's doing it on their reflection.
Or maybe he's zooming in on himself and he's gonna pop that right there.
Oh my god, Kevin!
Damn, girl, you're spooky.
So they originally had penicillin, but they called and said, oh, he has a family history of dying. So they changed it. And I don't think they know the dosage of this new medication.
Is that? Hi, Nurse Katie calling about Kenneth Bronson again. I have a bit of an issue with the ceftriaxone. It is contraindicated in people with a hypersensitivity to penicillin, so I'm not sure if this is the medication that we should be giving him.
He's gonna say, just give it. Just give it. Come on, he's trying to go on a shock right now.
Reaction, so yes.
Okay, Kenneth.
I concur.
We have your injection ready. We're giving you a different medication that's not penicillin. So
Why can't you just give me a prescription of Spectrum like we did last time? Alright.
Bailey's a pro. Okay, you're just gonna feel a little bit of a prick, okay?
Ow.
If you ever have to get steroid
Almost
do not
done.
put it in
Okay.
really fast. You'll bring them off the
There we
table.
go.
What is it called?
All done.
Phenergan.
Like it just hits you painful, like that.
Oh yeah, it burns and it's painful.
Okay.
And I'm not
That
kidding you,
wasn't
they'll
too
come
bad,
off
was
the bed at you.
And what type of
Well, it's all over now. No more needle sticks.
Okay.
His oxygen's dropping.
So good.
How you feeling?
Yeah.
Feel okay?
You're like, and getting something
They're both
else.
just,
Yeah. Well, that's not.
they're standing and eating.
Wrist pulses are all fine.
He's not gonna go into
We're
shock.
gonna sit you back up.
You could tell.
Yeah.
Those by
They're
the
like
They're
just
like,
like pulses.
Can I take his blood pressure again? Yeah,
Certainly.
his respiration.
It's gonna be fine, watch.
You having a cough there?
Something doesn't feel right.
Okay, he is going to shock.
Man up to the ECG.
Okay, I'm just gonna listen to your lungs. I'm hearing wheezing. Hi, this is Nurse Bailey with Kenneth Bronson. I believe he is having an allergic reaction to
Is he
the
though?
medication we just administered. He's coughing, he's short of breath.
he's probably just like
having
choking
trouble
on it.
breathing.
We just have
We're
like
putting him on a non-breather.
He's having an anaphylactic reaction to this medication.
No, you're not gonna die. It appears that you might be having an allergic reaction. We're gonna give you some medication to help reverse that, okay?
Help me.
Okay, I'm gonna give you a shot of epi. This should help you breathe better, okay?
Ooh, damn.
Alright, she just gave you a shot of epinephrine. This should start to help open up your airways again. Okay,
I'll look it up. I just saw her because I remember.
Another injection.
Rididine, get it. I didn't. Would you still use it in this situation?
Again, nitro and aspirin, and it was he was not having a heart attack. There was like nothing.
In the order it
Had
said.
been like. It had
Okay, another pinch.
But on the she's on it, and she's like, this person will breathe today. It's all the oxygen
Okay,
mask.
last one.
What's that other medication called? Not the Benadryl, but the other one.
Oh my God, things you cured me. I feel so much better. What happened?
Shock.
That was stressful.
Okay, so we finished. All done. We passed. I hope so.
We have our exams now.
Yeah, so now we're gonna go study because we're probably gonna fail our exams.
Yeah, most likely. It's okay.
But it's fun times.
Who?
What?
Nursing is. Oh, dang, she does, doesn't she?
Kitty, you look like you're just coming out of the hospital. You still have your mask on and everything.
Did you like put them back from the beginning?
Yeah.
But then there were some weeks.
Okay, so I'm in my car now. I'm getting ready to leave, go home. I'm starving. This has been a long day of sim lab, but I just thought I would go over. Actually, I'm gonna start driving because I really need to get home and eat some food. So we're back to this shitty car setup for a second, guys. I'm sorry about it. I'm working on it. It's under construction, okay? I'm getting it figured out. I will have some type of stand or something soon. Anyways, found out we were in the urgent care treating him. So he had a positive strep test. We were supposed to give him penicillin and then send him on his way home. So we started asking him questions. He had no allergies. I asked if he had any family history of allergies, and he said yes to penicillin. His dad died. So I called the provider, the nurse practitioner, and told her, the guy running a simulation is the nurse practitioner. He plays anyone you need to call, like pharmacy, doctor, family, whatever it is, he's playing it, obviously. So we penicillin because he might have a reaction. So then she gave me orders for another antibiotic. However, that antibiotic also is contraindicated to be given with people who have a sensitivity to penicillin, which is a potential factor in this guy's case. He could potentially be allergic to penicillin. So I call the provider back again and tell her no, like he can't get this. And she's like, it's fine, just give it to him, it's fine. So I gave it to him. He had an allergic reaction. We had to administer epi and diphenhydramine, which is Benadryl, and then Pepsid, which is a histamine H2 receptor blocker medication, something like that. It's usually used in like indigestion and stuff like that, like GERD and stuff. But it's because it blocks the other histamine receptor in your body, which I didn't know. So Benadryl blocks H1, and then this one blocks H2 to completely stop the allergic reaction. Very interesting stuff I learned today. But yeah, so I had to administer those, and then he started breathing again. So I learned a lot today. I feel really good about how today went. I feel really confident. I mean, definitely a long ways away before I can. Oh, they're taking couple photos in the street. They're taking wedding photos in the streets. Oh, how beautiful. Wow, oh, there's a whole wedding in there. So romantic. Okay, I need to stop getting distracted. There is a long ways to go before I can work confidently as a nurse in the hospital. However, I do feel better about it. Every time I go into sim lab, I feel better about it because these are the only patients that we're taking care of besides the virtual ones, which aren't even really, they don't even really count. So today was really fun. I really hope you guys enjoyed coming along to simulation with me. I hope I was able to get some good footage. I don't know how many other nursing programs do something like a sim lab. I know a good amount. I've talked to nurses in other programs and I've seen them do, and I've heard about them doing stuff like this. So I hope this is a good little insight if you guys are wondering what it is, or you're a nursing student that's nervous for your first sim and you want to see what you're going to be doing, then I hope this video helped you guys. Thank you for watching. Like and subscribe and all the things. And I will see you guys again in my next video. Bye guys. I'm gonna crash if I try to wave at the camera and drive at the same time, but